When communicating with patients, it's essential that we communicate clearly and concisely. If you're trying to establish a diagnosis or a treatment plan, you have to be able to communicate in such a way the patient can understand. When you have a patient whose ability to speak English is impaired, this can present problems. Can you just turn these patients away? Absolutely not. It's against the law to turn patients away, particularly if you work in an entity that's Medicaid or Medicare funded. When dealing with people with limited English proficiency, we many times have to retain the services of an interpreter. In cases where you don't have skilled interpreters, perhaps you may want to use one over the phone, and these people are available too, but many times cues and some of the communication can be missed because the interpreter is not physically present. What can we do to help people with limited English proficiency? Many times we rely on an interpreter that the family provides, a family member. Many times these people aren't clinically trained, and they can often cause as many problems as we're trying to mitigate. Some doctors use staff if the staff is proficient in the language that we're trying to interpret. This is an easy recourse for a physician if the staff is available. The best recommendation is to use trained interpreters. These people are proficient in the language that we're trying to speak, and many times they have clinical training as well, and the communications can be accurate and precise, but we have to pay for this. Physicians don't like it, but I've just learned to accept this as part of the cost of doing business. The last option is to use interpreters over the phone. This is a viable option. It's efficient, it's easy, but many times the translation may miss certain cues that are nonverbal and miss part of the translation. Don't forget that if you send your patient away with written instructions, to be sure that there's translations for those as well. Above all, treat the patient with dignity. Never show frustration in trying to communicate with them, and document your overtures to do so.